by the Department of Justice. What they're trying to do is keep as much choice and competition out there in the marketplace, which we certainly agree with. So, in terms of the marketplace that Aetna pulled out of, that's more of the individual and family, where you can go out as an individual to the exchange and quote those kinds of things for yourself, and we don't participate in that here locally. So we do more of the group plans like yourselves.
So what's your crystal ball say? 15 months from now.
So what my crystal ball at Cigna says is that we are betting on the wellness and the health improvement. Those are the things that we're focusing on because clearly the cost of healthcare is going up disproportionately with kind of like the cost of living. Everything's going up. Everybody's salaries are kind of staying the same. So what we are trying to do is propose that if we take better care of ourselves, then our own claims go down because we don't have the higher cost claims because we're taking better care of ourselves, and that's why we propose. You guys were paying for a wellness vendor that was helping you with your wellness program, and now we are providing that as part of your medical benefits.
How do you police that? I mean, you're checking people's urine every month for nicotine and breathalyzers for alcohol.
Well, we will work with Brian and with the team here to try and come up with a program that works for your employees. We can't force anybody to do anything, but what we are seeing is more groups that are going to where your employee contribution, the employer contribution to the employee's premium, is affected by whether or not you are involved in the wellness. Because we think if you are involved in the wellness, because it's powerful when you go to the doctor, and because a lot of people think they're healthy because nothing's wrong today, but they don't know that because they haven't been to the doctor in 5 years. They may go and they may have a ticking time bomb in their chest, or they may be pre-diabetic, or there's a number of things that can be going on with them. And what we try to do is incent people to take better care of themselves, to get their annual checkups, to do the biometric screening, so that we can try and head those things off the pass, so that they don't become a massive heart attack with a quadruple bypass, when we could have seen that through an annual checkup that they had high blood pressure, and we could talk to them about an exercise program and a diet. So that's what we are trying to do, is to get people to think more about taking care of themselves, and then maybe fix the problem that way. In terms of fixing health insurance, how much do we I don't have those answers for you, unfortunately. I'm sorry.
So you're saying keep the wellness program going, and that will keep our costs down.
That's what we when we came in last Thursday. Instead of telling Brian how great we were, and we think we are pretty great, I asked one question to start the meeting, and that was, what are your biggest pain points right now? What can we help you with your employee benefits? And he said two things. Service, because I understand your HR person recently left, and you need a carrier that can take good care of you, and we can address that. And he said the wellness program, because the vendor that they had been working with pulled out of this market, and so everything that we do, Rhonda is your new dedicated health improvement strategist that will work with Brian, with Lockton, and with your employees on a wellness program suited for your employees, that you don't have to pay extra for. It's part of the health insurance costs that you're paying for the upcoming year or 15 months. If you have any more, yes, sir.
So if I understand correctly, your proposal is cost neutral for 12 months. Why 10% bump for the last 3 months?
It's actually only a 4% bump, so I would have to take a look at the numbers to see what. But the rate from underwriting was 4% for the extra 3 months of coverage, and the reason that is in our lives we call it cost of living. In the medical world we call it trend, and it's basically the cost of medical goods and services that go up, and the way our mathematicians have calculated it, it's about 4% a quarter, and so we were adding an extra quarter to those rates, and so a 4% trend into those rates.
And when you priced our business,
Mhm.
did you price it based on claims?
Yes.
And so we should not expect some makeup premium for the next year? Whereby you buy the business, you come in low, you buy the business with the intent of making it up over the next few years?
Correct. Cigna is a little different than some of the other carriers in town. We are not as big as Blue Cross and United. They like to go out and write lots of business. We are a lot more focused. We try to pick partners that because yes, to get competitive oftentimes on the first year, you have to gouge your rates a little bit. And so we know that going in next year, we're probably not going to make any money on city admissions benefits in terms of claims that we pay out and the premium that we bring in. We try to target that, and you know we're a for-profit business, so
What
we
is
do want to make
your target? What is your, there's obviously the premiums that city pay, and then there's claims that you guys handle. There's a percentage. What is the percentage that you're looking for, usually to stay under?
in terms of a loss the first
Right.
year.
Well, it's each healthcare provider has a percentage
Mhm.
that they want to make. So usually that's provided to the entities that you're dealing with. So you have a target percentage you're trying to make. And if we go over that percentage, then probably we're going to get a premium increase next year. If we stay under that percentage, then we could see some benefits. So I'm just asking, what is
Correct.
your
Yeah.
percentage?
I don't have a magic number to tell you on that. You know, if you have a catastrophic year where you've got where we lose millions of dollars, you know, you have some monster claim. You know, but to be honest with you, and I think Gail can attest. You know, Lockton is they're the biggest and the very best consultants in town, and so they are our number one partner. We try to take very good care of them in their groups. We know that if you have a bad year your first year, we're never going to make that up if you leave first year. So we always try and target working with groups that we think will partner with us year over year, and we can put in place. You guys can take advantage of and get to know Cigna as your health carrier, and that if we lose a bunch of money next year and hammer you with a big increase, you're going to leave, and we'll never make that back. And you'll walk away with a bad taste in your mouth with Cigna because you were with us for 12 months and then we kicked you in the teeth. So our underwriters try to take into consideration how involved the group is in their wellness. You know, because if you look at a group that has a bad first year, a lot of times it's because of one or two claims. It's not. It's usually not systemic across the entire group. It's usually, you know, so the underwriters try to take a long-term view at those things. So I don't have a magic number to give you. We expect to lose probably about 10 to 15% under break even on the first year, to be honest with you. So I think that probably is as good an answer as I can give you.
One thing, Casey, let me, if I might just touch on, because one of the challenges that we have as a small group is we get very little claims data that's provided to us. Just any group under 100 lives, and we struggle to even get anything in the aggregate that allows us to sort of look at, manage, have some of those numbers and some of those targets. One of the things that was attractive about Cigna's proposal is they shared with us is that although still at a very high level and in the aggregate, they will and can make available to us as a smaller group some of that information. So we can see utilization for in-network providers. We can see emergency room, urgent care, some of those things that may be real cost drivers in our plan. And that is very beneficial for us, and that's not something that we've had access to for the last several years.
Because of the size?
The size of our
Too
group.
small for the
Yes.
carrier to keep that data for us?
It becomes
won't
a
share it.
HIPAA, I mean, it becomes a HIPAA issue and it.
Oh, I'll say
Yes.
okay.
So that was one of those things that was important. And so we sort of operated blindly
Right.
because of our group size. And now hope we have an opportunity to at least have a flashlight to shine on that.
Has anybody calculated the disruption factor?
Yes.
So we have every hospital in the Kansas City metro area is in our network. We looked at we call it geo access report to make sure that everybody has access to care within a very small radius of their home. Our network is just as big as anybody else's. Our discounts with the providers, our contracts are excellent. So yeah, Lockton, that was part of their marketing process, was doing a deep dive in our network.
What is that disruption factor?
I don't know, but I think, I mean, it would have to be less than 1% or 2%, or it would have been flagged.
Okay, so,
And if there is any disruption, please, and Lockton knows this
well, there's a
as well.
calculation in your industry where you can compare
Correct.
programs, and when you do make changes, you can calculate the disruption to
Correct.
employees. Usually there's a calculated number, and the entity has to decide whether or not that's worth changing, making that much change for the dollars.
Right, and I can tell you that here in town, when we go up against any of our competitors, it's usually somewhere north of 98% match.
Okay.
So there really is no concern there, and if if you do have an employee that their doctor is not in network, Lockton knows, my network VP sits right outside my queue, and they'll reach out and try and get that doctor in network very quickly.
You heard the city describe its wellness program, and we're going to not do what we've done in the past, but I hear you saying that you see a more beefed up, what is your opinion of our wellness program right now?
I think you were taking great steps for a while, and you were paying an outside vendor to help you with those things. Those are all things that are value-added services that are part of what you buy when you buy Cigna. So I think you're going to get as good of or better. For example, our biometric screening event is free. You don't pay for that. We come on site, we do it. You get a report after that telling you not anybody's individual information, but an aggregate report about the group and the risk factors. Maybe you have 30 people with high blood pressure, and you have a couple people that register as diabetic. So you'll get a report that we can then target what we do, and we have our health coaches that can reach out to people and try and help them to work towards heading those conditions off the path.
I guess I'm asking for your professional opinion of the wellness program we have in place right now, but I heard you say it was very important to your organization.
Mm-hmm.
So I'm assuming you have a plan in mind. Is it the same plan we have now? Is that okay what we're doing? Should we be beefing it up?
Oh, obviously, I mean, I think there's always room to beef it up, but wellness is an interesting topic in our, because the proof is in the pudding. I mean, it does work if you can get engagement. And I think you guys were already doing things that we try to get groups to do in terms of really pushing the employees, almost making it mandatory to be involved. So I think you were on a very good path, and I think with our partnership, I think we can make it better.
But we could incentivize even more.
Yeah, I mean, my paycheck at Cigna is greatly affected. My employer gives me a set amount of money if I'm not involved in our wellness program, and then they give me a whole lot more towards my premium if I am. And I think that's where people, I mean, honestly, people are going to ignore it until it hits the pocketbook.
$30 doesn't seem like.
And ultimately, what we're telling, what we think is that it's going to affect your pocketbook a whole lot in ways that you may not see it on your paycheck. But instead of, maybe you can avoid hitting a deductible of $1,000 or whatever, over time you can save yourself maintenance drug costs and head off a large claiming path. So we are trying to help them see, and it helps you as a group, because if people are healthier, they're more productive, they're not absent as much. So I mean, we think it's a win-win for all involved.
You offer experience from your other clients, what's worked and what hasn't worked in wellness programs.
Yeah, so
Constellation.
I think one of the weaknesses of wellness, from the carrier side, is carriers have been guilty for years of talking about wellness on the front end as salespeople, and then abandoning it the second the group is implemented with us. And we thought that was, we looked at ourselves in the mirror as a carrier and said, well, that's shameful to preach about this and how good it is, and then never do anything to back it up. So we added Rhonda, who is, her job is to engage with you. And if at the end of the year your group refuses, then we looked at ourselves and said, okay, we did our part to try and get them engaged. And so, you know, we looked at City of Mission and saw a group that was trying to engage, and we went, oh, this is great. We're going to help them down that path. And so, like Brian said, we have experience from other groups. Sometimes it's as easy as, we had a group not too long ago, they weren't getting any traction in their wellness program, and so Rhonda put together a wellness committee with a handful of employees, and it turned out all they wanted to do was be able to wear jeans one day a week. It's that simple. It wasn't a big deal. It wasn't $500 in their paycheck. They just want to wear jeans. And so that group now, if you do this, and this, you can wear jeans on Fridays. That's great. I mean, and I'm not saying that's the answer here, but we look at it and try to tailor it to City of Mission and to our other clients and see what will work for them. So we've got some experience there.
But you know, we should get a motion, and then please, you guys stay up here, and then everybody, many questions as you want. If we can get a motion to start our discussion, that'd be nice.
Mayor, I move that the city council approve an engagement with Cigna Healthcare for the provision of employee health insurance benefits effective October 1st, 2016.
Second.
Is there any discussion? Please take as much time
I
as
have
you
a
need.
question. Just, do you provide any training forms or anything about, medications and the difference between pharmaceutical versus vitamin and those kind of things? Because pharmaceutical has gone up even more than the
Yes.
medical
Absolutely.
genre, if you will.
Yes. Yeah, I mean, we have coaching on that. Your client manager isn't here this evening, but she's here to help coach your employees. We have our wellness coaches that can reach out. In terms of drug information, we've got as much as you want. And honestly, that's the stuff that Lockton brings to the table as well. They are excellent at figuring out what your employees need and engaging us to give them to answer those questions. So, you want information, we got it.
Susie, and then Kristen.
I just clarify this for me. I'm assuming what I read is that the premiums for the employees will not change that much from what they're paying right now, correct? I'm looking at what they pay now.
Yeah, there'll be a slight increase.
Maybe, well,
3 to 4%. Yeah.
okay, for a family with 4, right now, with the new segment, they'll be paying $346, or divide that into per paycheck check.
Right.
And so approximately what are they?
That's about 2%.
$12 to $15.
So that's, I don't want to hurt the employees any either. I want to make sure that we take care of them that way. That even though we're changing policies, I want to make sure it's not a cost of our employee.
I don't think I mentioned this too, failed to, with those that are participating in the wellness plan right now, to sort of kind of ease the impact a little bit,
Right.
we're planning to pay them a one-time check of $120, which basically will cover the next 4 months, to kind of finish out the year of the wellness plan. So that kind of helping impact a little bit for those folks
That'd be great.
doing away with the wellness plan.
Thank you.
Sorry, I meant to mention that earlier.
Kristen?
Yeah, have you guys looked at like health savings accounts in conjunctions with high deductible health plans?
That kind of came up sort of at the end of the discussion, so we haven't really looked at it in great detail. I know a number of employers are kind of moving in that direction. The challenge, I think, with being kind of a small employer, sometimes it's a little bit, it makes such a leap like that. We have to kind of work in phases with our employees and something like that.
And then I don't know.
Let me jump in
Oh,
really
sure.
quickly just a moment, because this year we did not go through we did not solicit quotes on a high deductible plan with a health savings account. We have done that in previous years. As Brian alluded to, our challenge, again, being a small group, is we almost have to do a full replacement instead of kind of a slice offering, because it tends to drive your healthier employees to that high deductible plan. And then you're dealing with an even smaller pool of folks who may have significant health issues to kind of share in those costs. So we have gone through very detailed analysis for several years, and the high deductible plan as a full replacement, we couldn't get the math to work out to a point where previous councils had been comfortable with that, but it's certainly something we will continue to look at.
And then is there any way that we can like team up with like Johnson County for health insurance or?
You know, don't laugh, because we're actually having these discussions. You know, a number of city managers have had their assistants and their HR folks kind of get together and begin some discussions about how can we leverage, not only the cities and the county, but the school districts. So we're talking several thousand lives at that point. And you know, working with a broker, going to the Cignas of the world and saying, we got 5,000 lives,
Right.
give us a deal.
It's significant,
Yeah.
you can,
But-
especially if you're looking at an HSA high deductible. You've gotta have a lot of people like Laura
Yeah.
said.
Or a variety of plans, yeah. You get off the
Yeah,
HMO,
that's-
UPL, and high deductible plan.
So maybe something we're working on in the next 15 months then.
Yeah.
And we've looked at pools, there are some pools that exist in the marketplace, now. We've gone through other marketing renewals, we've included, those in our market analysis in previous years. So we try to look for, any way we can maximize and leverage the dollars that we have that we're spending.
All right, thank you.
Have we evaluated self-insurance?
Not self-insurance, but we explored the idea of joining a captive. And I think with the captives, a lot of administrative costs associated with that directly on us. And kind of with our limited staff, that seemed to be a bit of a challenge. But it's not something we've completely ruled out yet, but we'd like to give that some more thought and really understand what's all involved with that before we seriously give that consideration.
Any more questions? Well, we have a motion on the floor. Could you please call the question?
Yep. Quinn,
Aye.
Rothrock,
Aye.
Crane,
Aye.
Inman,
Aye.
Garrity,
Aye.
Gibbs,
Aye.
Appletop,
Aye.
motion carries.
Okay, thank you. Thank you very much for coming. If there is no other business, well, there is no other business. I would entertain-
Motion to adjourn.
Second.
Everyone in favor? Say aye.
Grueling. Thank you for having me.
I know, because we didn't.
Thank you very much. Thank you for having us up, sharing the info.